So we had a poster at SOHO looking at long-term outcomes with Isatuximab, Carfilzomib index, or what we call ISA-KD, from the Phase III IKEMA study. And we looked specifically at patients who had one Q21 gain. In fact, we actually broke it up into four subgroups. We had those just in general that had evidence of one Q21 increase. We had those that had just the isolated one Q21. We separated out those patients that just had gain, so 3 copies of one Q21. And then we looked at those that had amplification, so had 4 or more copies of one Q21. Now, I'll remind people that the IKEMA study was a randomized study of ISA-KD versus KD in 1 to 3 prior lines of therapy. And actually, there was a fair number of patients that had basically the 1Q gain. So overall, it's about 125 patients that had the 1Q gain. And so what we did is just with 44 months of follow-up is, looked at subgroup analysis of the 1Q21. And in fact, all those 4 groups of patients in general did better, obviously utilizing ISA-KD versus KD. So the isolated one Q21 did quite well. The gain one Q21 did quite well. Just overall, one Q21 actually was quite good. The one group that was the toughest group was those that had amplification of one Q21. Those patients, didn't do as well. But there was also a smaller number of those patients. If we look at patients that had basically achieved a VGPR or better, overall, if they had a 1Q21 with ISA-KD, 73% of them achieved a VGPR or better, whereas only 52% of the patients actually achieved a VGPR or better using KD. If we looked at MRD negativity with 1Q21 overall, 35% of the patients achieved MRD negative with ISA-KD, and only 15% of the patients achieved MRD negativity with KD alone. If we looked at PFS, the PFS was best in patients without 1Q21 receiving ISA-KD, but patients with 1Q21 did quite good. The patients with just isolated 1Q21 did quite good in gain. But again, the worst population was the patients who had amplification of 1Q21, who had a PFS that was around 18 months. So really, I think the take home from this is that Isatuximab Carfilzomib index actually has shown, in my mind, one of the best outcomes in the relapse refractory setting in patients who have gain better than amplification of 1Q21. And I think it's a great regimen for those specific patients. But in general, in all the patients in the 1 to 3 prior lines of therapy, this study showed a PFS of about 35 months, which is pretty amazing in the relapse and refractory setting. And so that's one of my favorite go-to regimens in the 1 to 3 prior lines of therapy. If they haven't had, especially if they haven't had a CD38 antibody, ISA-KD is a great regimen.